social justice principles, which are values that aim to decrease or eliminate inequity, encouraging inclusiveness of diversity and establishing environments that are supportive of all individuals. These are known as equity, diversity, and supportive environments. Equity means that resources are allocated with the needs of individuals and the populations within Australia, with the desired goal of equality of outcomes. To achieve equity, the government needs to recognise the needs of different populations within Australia.
Health facilities and services are in general any location where healthcare is provided. They can be either institutional, such as hospitals or nursing homes, or non-institutional, such as general practitioners, dentists, research groups, and pharmaceutical services. General practitioners are a community service and often the first point of call into medical and health services for most Australians. Rural and remote. People in this population experience inequities regarding access to health services as there are less specialist services and treatment for certain health issues. For example, there are less specialist oncology services for those who live in rural areas and limited access to hospital services, especially a lack of private hospitals.
Aboriginal and Torres Strait Islander people typically die at much younger ages than other non-Indigenous Australians, and are more likely to experience disability and reduced quality of life because of ill health and preventable diseases. This is mainly because of limited or poor access to health facilities and services. This limits their access to important contributors to well-being such as dentists, general practitioners and hospitals. The barriers that exist include long waiting times, cost, unavailable services and culturally inappropriate services.
Low socioeconomic. The cost of health services and medication may not be in the budget for this population group. Certain treatment, surgeries and checkups can be expensive or unaffordable for this group, and therefore limiting their access to certain health services and facilities that they need.
Low education. People with low education about the facilities and services within Australia and in their local town or city mean they have little knowledge about what health services they can access and how to access these services. They're also limiting their access to health services and facilities. The Royal Flying Doctor Service of Australia is one of the largest and most comprehensive aeromedical organisations in the world. Using the latest in aviation, medical and communications technology, they deliver extensive primary health care and 24-hour emergency services to those who live, work and travel throughout Australia. Medicare. This was probably the biggest action by the government for equity of access to health facilities and services. Medicare is a federal health insurance program available to all eligible Australian citizens and visitors. This provides access to a range of medical services, lower cost prescriptions, and free or subsidized care, treatment and accommodation for public patients in a public hospital. Medicare does not cover most ancillary care providers, other than the allied health and dental care provided through the Allied Health Initiative. This allows some rebate to be claimed for people who are chronically ill. Allied health providers include physiotherapists, osteopath, chiropractor, exercise physiologists, occupational therapists, and psychologists. Private health care insurance brings with it the benefits of not paying medical levy surcharge and often has the private health insurance rebate. This helps make private health insurance more affordable and allows for a faster access to elective surgery, avoiding the waiting lists in the public system. However, private health insurance is designed to benefit people with a higher socioeconomic status and a high income. It is expensive to take out and provides those who can afford it a greater health care than those who cannot, therefore enlarging the inequality within the health care services and facilities. It allows for a wider population to access all healthcare facilities and services. This results in particular groups within Australia receiving more funding and being identified as priority population groups because of their poorer health outcomes than other Australians. ATSI are an example of a group who require additional funding and resources in order to improve their health outcomes.